Okay, so we've put in the administrative data for the patient, and now we're in the screen that we need to select the type of restorative or the restoration that we're going to mill and fabricate for tooth number 14. So we're going to do a full contour crown, and the selection you have is screw retained crown, multi-layer abutment. So let's go ahead and select just screw retained. And it's going to bring us up the options that you know about: biogeneric individual, biogeneric copy, and biogeneric reference. Since we have pretty good dentition all around number 14, we're going ahead and just select biogeneric individual. And now we're going to select the milling device. It's turned off, so it's not green or highlighted. So we talked about TiBase versus scan post. TiBase, we're going to be using that on a poured-up model or cast, whereas the scan post, you're going to use intraoral. So today I'm just going to show you how to do the extraoral scanning using the TiBase. And so and you'll see right there, it's TiBase. You need to make sure you have the correct implant system selected, and so we're using Nobel Biocare Replace Select, so NBRS, and the size of the implant diameter is 5.0. You see I can select it there. So the type of scan body, either it's TiBase, which we're going to be using extraorally, or scan post, we'll use intraorally. Really the difference is the scan post is longer and taller. I found if you try to use the TiBase intraoral, it's too short, and sometimes if you have a deep placed implant, you will lose it, you can't see it, and technically it's not FDA approved for intraoral use anyways. Since I have the cast already made, I can go ahead and just select TiBase as my scan body. And then we're going to pick number 14. Voila. So once you have all that information, you just want to double check your case details that everything you've selected is correct, so forth. Let's go ahead and acquire. What I do, once I advance it to the acquisition mode, there's one catalog that I want to add before we actually scan. You'll notice they only have the lower jaw, upper jaw, and the buccal bite. The upper jaw is defaulted because we selected number 14 as the tooth or the area we're scanning, so it automatically defaults there. However, I want to get a tissue moulage scan. So if you upper right, you look, it says add catalog, select gingival mask upper, since we're working with tooth number 14, and that adds another catalog down at the bottom. You'll see it highlights gingival mask upper. What I'm going to do is just scan the tissue. So it turned on there. I pick up my Omnicam, and you'll see it on the screen, just the tissue. It's a quick little scan, picking up tissue, just like you would for a model, the tissue moulage. And so it scanned that. Now I'm ready to actually scan the TiBase. My recommendation is to go ahead and turn off the camera and take off the tissue off your cast, and go ahead and put the TiBase on the cast. You can't see that since it's only, I'm doing this outside. You can't see it because you're only seeing the screen. And so what I'm doing is I'm putting the TiBase onto number 14 without the tissue, so I can actually look and make sure it's seated correctly on the implant. Actually, I could probably take a video of that and you could see it. And so what I did is I just took the TiBase and placed it on the 5.0, and I can actually see it without the tissue. I can see that it's fully seated onto the cast. If you were to do this intraorally with the scan post, you would then have to take a radiograph and confirm it's seated, because obviously the patient's gingiva is in the way. But now that I removed the tissue moulage, you can see that it's fully seated. And now I'm going to grab the scan body and place that on there. The Omnicam is gray. They are gray and white caps. And I'm going to marry those up so they're correct. And I'm going to show you again just with the video. You'll see that gray cap. It is a triangle. The triangle is an isosceles triangle. The two longer sides are pointing to that little outcropping. You can kind of see now that little bleb or push out is where that has married up with the TiBase, and it's fully seated. You just kind of push down with your finger and make sure it's seated. In the mouth, you may have to use a hemostat to make sure it's fully seated, and it goes down. Suggestion is you can also mark that little outcropping in marker, so a Sharpie or something like that. But once that's on, you can go ahead and scan it. Make sure that you are selecting the upper jaw, and go ahead and select that. Turn on your camera and you'll see it here with the scan body on. This is going to be a full scan, so I need all the teeth adjacent to the implant. You don't need like necessarily a full arch or the full maxilla, so I'm just scanning the teeth. I really don't need that third molar, but you know, OCD, I like to grab it, I guess, but just make sure you get everything covered. We've noticed that with the Omnicam it's difficult sometimes to get the proximal contacts. You see how I rolled it back there on that premolar, and it looks like that molar contact has been captured. And as I turn off the camera, you're going to watch it. It's going to marry up the tissue upper mass that we took with our scan. And it's kind of, what would you say, a little bit transparent. But as I rotate it around, I don't know if that's necessarily a bad thing that it didn't capture. Maybe I'll just go back in there and scan it a little bit more just to be sure. But it's kind of captured the top portion of the scan body. I'm just going to go in there and grab it just to make sure. Just going to rotate it, pick it up. So I think I got it. All right. So now the next is pretty straightforward. We'll go ahead and scan the lower arch and then the buccal bite. I just like to scan distal to mesial, then I rotate it, push it back from the buccal, rotate again, go from the lingual, pull it through, and that's pretty much all you need. And then we'll go ahead and scan the buccal bite. Now sometimes the scan body gets in the way of your occlusion and you can actually take it off, but in this case you'll see that I'm able to occlude and take the buccal bite with the scan body not in the way right there, but just getting the buccal bite like you normally would do, and done. So let's give it a second for it to think, and then we'll advance it forward. Looks like everything down here looks good. The gingival mask married up and it gave me a green check, so that means that I got a good scan and they're able to connect to each other. So let's advance it forward for the model and let it do its thing, just like you would for any other restoration. My understanding in the new software 4.5, this might be a little different, but it gives you just a visual cue as it's correlating the models. So the models have been correlated, and you'll notice that they have the occlusion. Just double check, look at, you have even occlusion everywhere, so the models will correctly capture in the correct bite. Sometimes, every now and again, I'll get a little bit of occlusion on the scanning body. You'll notice that right there, but I don't think that will be a big deal. And so what we're going to do now is set the model axis like you would normally for any other restoration. You can change if you want the upper or lower cast. Right now it's showing us the upper, so I'm just going to go ahead and change it to the lower jaw and just place it in the tray. Set your curve as B. I think this was a typodont, so they're somewhat straight. Sometimes you'll get somebody a little bit curvy. Kind of your curve Wilson there, but and you do that normally for that's nothing new. You know that step. So we'll advance it forward to the design. What you're going to have to do is you're going to have to identify the area that you want to actually trim. This is a required step for an implant. If you do a normal crown, you don't have to trim the model, but for the implant it does. So what I usually start is distal to the implant, double click to start or anchor. You can make single clicks if you want, if you get to go around, but you can then follow up with a double click and it cuts that distal half off. Just rotate your image a little bit and then do the same thing, medial to the implant, double click to start, single click, but if you have a good line, go ahead and double click, you'll see it cuts it off. Notice the implant grayed out. Just go ahead and double click on this image right here over the implant, and now it's the selection we want. Go ahead and hit apply and it'll trim away everything else. So we're just looking at a trimmed implant with the scan body. There's some little bit of chatter or a little bit of scatter there. I don't think that should be a big deal, but you'll see the next step was go ahead and click the scan body head. Very simple. Click on the head, just rotate it, get a good sight picture, double click on the apex of the triangle, puts a dot there. Now you notice our gingival mask is now integrated with our TiBase. It likes to guess or draw kind of a baseline. This not necessarily needs to be changed, but you just kind of look at how you want your contour, how you want your implant to look as it comes through the tissue. Some people like it to put that blue line just on the outside edge of your tissue. On a posterior implant, no one seems to take the time to actually mold the tissue anymore, but if you've got a nice tapered abutment for a healing, like a healing abutment that has some shape, this will actually be formed very well. If it's not, you're going to get a cylindrical tissue form, and then you'll have to either use a laser or some other type of tissue contour. But for right now, we're just going to edit the baseline just like you would for drawing a margin on a tooth. Start with a double click, single click, get you little anchor points. What I found is you've got to come back eventually to the original line. You'll notice I'm coming right there, double click, and it erases that line that it started with. And you kind of notice I may want to come up in here a little bit. So again, start with a double click and then single click to get you some little curves. If you do it too far, too fast, you'll get more of a straight line. And you see that looks like a pretty good baseline. And what I like about this software now is it tells you what tooth number you're looking at. So if you have a number besides 14, you click the wrong tooth. The dotted line shows you the axis of the implant, and that will come into play next. But we've got the baseline edited. We got the tissue moulage superimposed. Let's go ahead and define the axis. Now this really depends on how the implant was placed. The software is showing you what would be straight up and down, and you'll see the dotted line is kind of that implant. So that implant was actually placed a little buckle, probably a little bit too buckly. That's why we want to try to do guided surgery. But since this is a screw retained full contour, our main concern is really the straight up and down path of insertion, as you can see the contacts. So if I were to leave it right here, the whole of the screw channel will be more to the buckle, kind of up into your almost your buckle cuss. I don't know if you need to really change that per se, but if the axis is way off, then that's when you go to a custom abutment and then cement retained crown. But since this implant was roughly straight up and down, we can go ahead and go with the full contour. So the change it, you can do it up here. You see this little toggle button. You notice my crown or the path of draw is lining up, and I'm just changing that. You may have to change your rotation just to kind of see that. I don't know if you noticed that a little bit. I did it for you to show you that you can go ahead and align those. Those do not necessarily have to be aligned. It's just that dotted line showing you the path of the implant, and then you're just lining up your crown with your adjacent contacts. So luckily somebody at least placed that straight up and down, not necessarily buckled. Now it's going to bring you to some parameters that you can change, and these parameters, as you change them, are only for this restoration. So if you change it, it doesn't mess up the guy behind you. I usually don't mess with the milling offset, the proximal contacts, the occlusal contact strengths, the dynamic contact strengths. We've already done that with our other restorations, but if you want your own, go ahead and change it here. The gingival depth is, if you do a custom abutment, it will change that baseline deeper, higher. What I want you to do is go down here to gingival placement pressure. This allows you to add more material axial around the TiBase. If you leave it at 0, it will give you the minimal thickness. What I found, if you do a gingival placement pressure of around 3/10 or 300 micrometers, you'll watch the screen, you'll see it widening up, get wider. And so I found a 300, which is 3/10 of a millimeter of gingival pressure, gives you more material around the TiBase. Does give you a little snug fit as you're placing it, but not enough to hurt the patient. But you can increase that all the way up to 1 millimeter. It looks like 1,000 if you wanted to. So I just increased it to 300. So we've did our baseline, path of draw. We've done our increased our tissue pressure. Now let's go ahead and calculate the restoration. Don't know why it didn't do it automatically. I wanted me to actually push the button. So let's let it do its thing as it calculates the proposal. So this proposal is kind of way off. I'm just going to kind of close everything off to show you. Wasn't really pretty, and so there's a couple ways you want to do this, either with our different palettes. I don't know if we want to do a different segment here, but I'm going to go ahead and just use some tools. What I'm going to do is I'm going to line it more to the center. I'm going to use the move tool right now, move it, just kind of center it right now, and then I'm going to change the scale. And so as a whole, if you notice these arrows, I'm going to get the whole restoration and scale it up and down. It just kind of fills that space a little bit better. I know some people would want to take it and do this. Some people want to take anatomical circular, grab it and try to pull it, and you get kind of this elongated tooth. So what I did is I just changed the scale and made it fit the space, and then go in and do my light adjustments with the circular tool. Right now I'm only doing big muscle movements, like say, just kind of close the contacts. I'm ignoring the occlusal contacts right now, just kind of getting it all lined up. Looking down the buccal corridor just to see if this looks okay. You know, is that too bulked or is not enough? You know, since it was placed a little bit powdily, we'll have a little bit of extra space here. I'm going to go later in and smooth this, but for now I'm just kind of showing you getting it into the arch form. Make it look pretty good. So it looks to me a little bulky back here, powdle, but overall not bad. And then you can go ahead and either bring down your contacts. If you've had your contacts presets, go into tools, contacts, hit occlusal, and it's going to default if you notice that went down, and so you don't have to go and adjust them all, but it went down to whatever we set it down in the original system. And so I'm going to go adjust those just a little bit. I kind of like the light blue, dark blue, and it's still a little heavy. You'll have to do some intraoral adjustment if it's that. You notice I'm just bringing them down gently there. So I kind of got it lined up to see where our channel is. Not too bad, kind of centered there. Now the next thing is, you'll notice that our gingival mask is gone and there's some roughness. And so what I'm going to do is I'm going to smooth that out. What I found is add first, then smooth. What I'm going to do is just kind of take away my upper jaw and just have the implant by itself. Look around, you can kind of see, you don't want to place that like it is. That will mill with that anatomy. So yes, this will add tissue strength, so be careful, but I'm going to add just a little bit. You see I'm just bulking it out a little bit, just so I have room to smooth it out. See here, probably need to bulk it out a little bit. So once you kind of get it bulked out, the final tool is go in Form, select Smooth, and notice the area or zone. I call it the zone of influence, but it really is going to show you how much area is going to smooth. Bring that to a pretty large diameter and just go ahead and hold down the left mouse button, just like it's taking a flame to wax. You'll notice that smoothed out pretty rapidly, and as I come around, you'll see that disappear. If you didn't add, it takes away, and then you might not have enough minimal thickness around your TiBase, but pretty much smoothed it pretty quickly. Overall, looking pretty good. Some people even like to go ahead and smooth your contact area a little bit. I lost it just a little bit. I'll bring it back, but they'll go in and smooth that out. So if it disappears, you can add it. Some people like to go on the circular tool, just kind of lightly like that. Looks pretty good. So if you want to bring your tissue moulage back, you can go ahead and click upper gingival tissue, and you kind of see how it now blends in as it comes out of the tissue. And we might have a little bit of a gap there that I can add. That's not a big deal. So yeah, I'm going to leave a little plump. But you can kind of get the point, right? So the other thing I found is you got to watch these marginal ridges. Sometimes they're not equal level, you know. So just go in there, make sure they're all lined up great. But I might have just kind of closed that up a little bit. But overall, not too bad. So once you've got your final restoration, you like your contact strengths, you like your occlusal strengths, you got everything smoothed out, the marginal ridges are all aligned, we can now just go ahead and select mill and move it forward. We are using a low translucency meso block. They also have medium opacity. The medium opacity is also good for underneath as in a custom abutment. If you're using a full contour, the low translucency is fine. So we're going to select that. So we really have two materials I didn't show you in the beginning, but the two materials, you either got it out of Emax, lithium disilicate, or your zirconia blocks. So Incornis from Cerona, meso blocks are your zirconia. You can also do a meso block in Emax. They come with a pre-hole drill in it. So if I take away my restoration, you're going to see how that block already has the hole drilled in it, and it shows you right here it's already drilled. So with that said, you cannot move the sprue. There is not even an option to move the sprue, so you can't change the position that it wants to mill your crown. So unfortunately, you'll get the sprue in weird positions that you don't want. However, it is what it is. You do have the cast, so once this is milled, we'll be able to place this on the cast, adjust that contact, even though that sprue is in our way. There's two different block size. There's an A14 or an A16. It's selected for an A16. It's the largest block. Unfortunately, your mill is going to have to mill all of that to get down to the crown. So this, I call it a burr killer. These really use a lot of burrs to get through. And so looks good. We'll go ahead and select the mill, and then good to go.